Assalamualaikum warahmatullahi wabarakatuh. My name is FATIHAH binti Muhammad SUHAIMI, and today I am thrilled to share insights about the field of anesthesiology. Anesthesiology is a cornerstone of modern medicine. It ensures patient safety and comfort during surgeries and medical procedures. Anesthesiologists don't just administer anesthesia, they manage critical care, oversee pain management, and provide essential support in emergency and intensive care settings. Their expertise ensures that patients experience as little discomfort as possible while undergoing procedures, making this specialty vital for optimal outcomes. Throughout this presentation, we'll explore the role of anesthesiology, dive into the nervous system anatomy and functions, uncover key biochemical processes, and discuss diseases like ALS and their treatment options. Let's begin. So there are 5 contents. The first is introduction, next, anatomy, which is the nervous system, third, biochemical process, fourth, disease, and the last one is treatment. Anesthesiologists are highly trained medical doctors who specialize in 3 key factors: anesthesia administration, ensuring patients are unconscious or pain-free during procedures; next, critical care management, where they stabilize vital signs during emergencies or surgeries; last but not least, pain management, helping patients cope with acute and chronic pain conditions. So, becoming an anesthesiologist is no small feat. It requires extensive education, including medical school, years of residency, and often a fellowship in a subspecialty like pediatric or cardiac anesthesiology. This rigorous training underscores their critical role in patient care. Now, the anatomy of the nervous system. So, understanding the nervous system is crucial for anesthesiologists as it is the primary system affected by anesthesia. The nervous system is divided into the central nervous system and also the peripheral nervous system. First is the central nervous system. The central nervous system composed of the brain and spinal cord. It serves as the body's command center. The brain handles higher order functions such as memory, thinking, and emotions. The spinal cord acts as a highway for signals traveling between brain and the body. Next is the peripheral nervous system. The peripheral nervous system made up of nerves that connect the central nervous system to the rest of the body. It is divided into the somatic nervous system, which controls voluntary movements, and the autonomic nervous system, which handles involuntary functions like heart rate and digestion. Without the autonomic nervous system, 2 subsystems play opposite roles. The sympathetic nervous system prepares the body for fight or flight, increasing alertness and energy, while the parasympathetic nervous system promotes rest and digest, helping the body relax and conserve energy. For example, imagine you're in a high-stress situation like taking an exam. Your sympathetic nervous system kicks in, your heart races, your pupils dilate, and you become more alert. After the exam, your parasympathetic system calms you down, restoring balance. Now, how does it work? So, we have 3 types of neurons in the body. The first one is the sensory neurons. Sensory neurons carry information from the sensory organs to the CNS. Next is the interneurons, which connect neurons within the CNS. Last but not least, the motor neurons, which transmit instructions from the CNS to muscles or glands. The nervous systems perform 3 main functions. The first one is the sensory input. It detects stimuli like light, heat, and sound through sensory organs. For instance, if you touch a hot surface, your skin's sensory neurons immediately send signals to your brain. The second one is the integration. So, the CNS processes sensory information, decides what action to take, and sends instructions. This decision-making process happens incredibly fast, often in milliseconds. Last is the motor output. Commands from the CNS are sent to muscles or glands, enabling responses like pulling your hand away from the hot surface. Now, let's move on to the examples. First, sensing the environment, like hearing a car horn or processing whether to stop walking. Next, voluntary movement, such as playing a musical instrument, where the brain sends precise signals to your fingers. Third, reflex action, a sudden response to a danger, like pulling your hand away from a flame. Last but not least, autonomic response, such as feeling nervous before a presentation, with your sympathetic system increasing heart rate and alertness. Now, let's look at how these actions occur at the cellular level. The nervous system uses 2 main processes to communicate. The first one is the action potential and the synaptic transmission. First, the action potential, which is the electrical signal. When a neuron receives a strong enough stimulus, sodium ions rush into the neuron, causing depolarization. This electrical signal travels along the neuron's axon to its terminal. Potassium ions then exit the neuron, allowing it to return to its resting state, ready for the next signal. Next is the synaptic transmission, which is the chemical signal. At the axon terminal, the action potential triggers calcium ions to enter the neuron. This causes neurotransmitters to be released into the synaptic cleft, the small gap between neurons. These neurotransmitters bind to receptors on the next neuron, passing along the signal. Together, these processes form the basis of our every thought, movement, and sensation we experience. Now, let's go on to the disease, which is the amyotrophic lateral sclerosis, or also known as ALS. Amyotrophic lateral sclerosis, or ALS, is a severe disease that affects the nervous system, particularly motor neurons responsible for voluntary muscle movement. While the exact cause remains unknown, genetic mutations and environmental factors are believed to contribute. So the symptoms is when the ALS begins with muscle weakness and twitching, progressing to difficulty speaking, swallowing, and breathing. Over time, individuals lose the ability to move and communicate independently. So, the disease significantly reduces quality of life and it has no cure. Next is the treatment. While there is no cure for ALS, treatments can slow its progression and improve quality of life. Let's jump right into it. The first one is riluzole, which can reduce glutamate levels in the nervous system, slightly delaying progression. Next is edaravone, an antioxidant that helps preserve physical function. Last but not least, the symptomatic treatment, which includes medications for muscle cramps and respiratory aids to support breathing. In conclusion, anesthesiology is a vital medical specialty that combines a deep understanding of the nervous system, its anatomy, and biochemical processes to ensure patient safety during surgeries and procedures. The role of anesthesiologists goes far beyond administering anesthesia. They are critical care experts, pain management specialists, and lifesavers in emergency situations. Diseases like ALS highlight the importance of ongoing research in both neuroscience and medical innovation. By advancing our understanding, we can develop better treatments and perhaps one day find cures. Thank you for your attention.